When we moved to Portugal, we made a choice: no private healthcare. Having had cancer, private healthcare was probably out for me anyhow, and we were used to the public system in the UK.
We wanted to trust that system, the one that so many people told us to avoid.
Yes, and then Shelley needed surgery, and we were thrust into that system that everyone had told us about. We had read all the stories, the bureaucracy, the waiting lists, the language barrier, and we expected frustration.
But what we found was something that no one told us about. This is the truth about Portugal's healthcare, the reality behind the reputation. Hi, we are Gary and Shelley, and 2 years ago we walked away from toxic jobs and the UK rat race to design a life we actually wanted. Not rich, not retired in the old sense, but definitely free. Each week we will talk about the myths of retirement, the reality of burnout, moving to and living in Portugal, and how to change your life before it's too late. Portugal's healthcare system is public, and once you're registered with a local health centre, you get a number called a Número de Utente. That's your gateway to doctors, hospitals, and the SNS app, where you can book appointments and access prescriptions. Most consultations just cost a few euros, and emergency care is always free. It's a system designed to be accessible, but it definitely helps to understand how to work within it. One of the current issues that's sort of come up in the last 12 months is that to sign on at your local health centre, you have to have a NIS, an NISS social security number. And the issue with that social security number is if you are an early retiree or you're here and you're not working, you actually can't get a NIS number online like everyone else can. And that's caused some problems for certain categories of people. Because if you go to your medical centre and you haven't got that, in Gary's case, they were very kind and they said you can come back and give it to us when you get it, but most will just turn you away. Now, NISs are available at the main big citizen shops, okay? And those 10 citizen shops are very well documented and they're easy to look up. They're in all the major towns. You will need a set of documents. You can look in the notes for that. But, like everything in Portugal, perseverance is key with getting your NIS because it is very hit and miss process right now. So just bear in mind, dig in deep and make sure you've got all your documents.
I had a situation where I had to transfer my records from the UK to Portugal. I want to talk about that because obviously having had cancer and cancer treatment in the UK, it was quite critical that I transferred some of those records over and had to find a way to do it. And the most important thing, and I think this is with any diagnosis, but certainly with cancer, is you get an official diagnosis, which is a jumble of letters and numbers, which signifies the cancer, the type of cancer, the staging, and also some of the other important bits of information relating to your specific cancer and the treatment that you've received. So that was the most important thing, to actually get that information across, and that's easy because you have that. So what I needed to do in transferring it over is in the UK, and I'm sure you could probably do this anywhere, but with the UK public health system, what you can do is you can request a copy of all of your personal data and information. So I spoke to the legal team in my local healthcare practice, and what they do is if you make a request, then they have to react to that request. So they turned around and they basically put a file together with every note that they have on me medically right back to pretty much birth. So I've got every operation I've ever had, medication, hospital stays, etc., etc., everything that exists in my record. And so I got that, and that was all together in a digital package, which then, if I needed to, I could pass that on to whether it was my GP here or whether it was the oncology team relating to the cancer. So that was the first thing I did, is got all that information together. And I'd like to point out what they also did, which was great, is they got all of my scans, my ultrasound scans, my chest MRIs, everything that I'd had done, they managed to put that in a package as well. So which was great fun, going through those and looking at my chest x-rays from 2021, 2022, etc., etc. Meant nothing to me, but obviously to the medical people, quite important. So that was stage one, get hold of that information and get it all in one location. So I saved all that to my hard drive and got that together. Then I had a situation where I had to get into the system here. We talked earlier about getting hold of your Utente, so your medical number. And obviously you need residency before you do that. So you get your residency, you get your Utente, and then you should get your NIS as well. I was a little bit fortunate, and I don't know whether it was playing the cancer card, but when I went to my local health centre, I didn't have the NIS, and I'd attempted to get the NIS, but without much luck. And they were very accepting and said they would put me into the system with my Utente. Now, what was also surprising is not only did they enlist me and register me with the local healthcare system, but I was very, very lucky to get a family doctor, which is, I'm not going to say it's unheard of, but it's very difficult to do that. And I think part of the reason for that may have been down to the fact that I was a cancer patient and that I would need someone to help manage that moving forward. Despite the fact that I don't actually need treatment anymore, I just need to have checkups, etc. Anyway, get appointed the doctor, and then what I needed to do was book an appointment. They actually did that for me. Because I've been appointed the family doctor, then she needed to do a review of me. So she wanted to take me in, have a chat with me about everything. What was I up to date on all my jabs and all my checks, etc., etc., for my age and so on and so forth. So that appointment was made, and obviously when I went to that appointment, I talked about my cancer diagnosis and my treatment and the fact that I would need to transfer over the ongoing care. Now, there's only two things that I need in terms of ongoing care, and that is once a year I need to have a scan, which is an ultrasound scan of my thyroid bed and my neck, just to make sure that everything is okay there and there's nothing new and interesting for them to look at. And then the second thing is just to have regular blood tests. Now, and I was already at that point on 3 monthly blood tests because my medication had not stabilised where it needed to be. And I had been paying, and even up to that point, I had been paying for all of my blood tests to be done privately here in Portugal, just to make sure I was in the right place. And I was referring that back to my multidisciplinary team in the UK for them to make a decision on whether I needed to change my dosage. This now became the responsibility of my GP. So I had the blood test, she was happy with the results, and what she also did is refer me to the IPO in Coimbra, which is the specialist cancer hospital. And in fact, here in Portugal, it's probably the #1 place for cancer in the whole of Portugal. So the IPO in Coimbra referred me to the oncology team there, who then booked me an appointment with an endocrinologist, who would be the person that would be responsible for any ongoing care, scans, etc. So that was all well and good, and I think that came in, I'm just trying to think how long that took. I had the appointment in June this year. Oh goodness, I can't even remember now. No, it wasn't. It was before April. So it was the end of March when I had the initial doctor's appointment, and then it was the end of May when I had my appointment with the oncologist. So the first time I had to go and see the oncologist, oncology team, which was an endocrinologist, was at the end of May. And I went along and they reviewed all my details. They were comfortable that they knew what had been done, what I'd been diagnosed with, how it had been treated, and what the status was now. And they literally picked up the baton in terms of, okay, so we're going to book you in for your annual ultrasound scan, which was to be in the September, and we're just going to have a check on your bloods, etc. in the meantime. And so they went through that, did the paperwork to make sure I could go and get my bloods done and get that checked. And because I mentioned that I'd had a tiny issue, they decided to also do an additional ultrasound on the spot there as well, which is something I've never experienced before. Because in the UK system, if you need anything, then you have to go through a very long process. It goes to that person, then you get a letter, then you have to ring up and book, and so on and so forth. It can take months. So that was a very, very good experience, and it brought me pretty much up to date. And essentially, it was at that point you could say that my ongoing care had been transferred from the UK now and was officially in Portugal. So that's all well and good. We've got everything where it needs to be. They've got all the information they need. We're booked for an upcoming scan. Everything is exactly where it needs to be. So there's two things I'm going to say. One, that is, as a cancer patient, that is a massive relief to know that these things are lined up and everything is where it needs to be, and that you don't have to worry for another 3 months or another 6 months until the next time you have to have a scan or a blood test, etc. So that was extremely good, and it worked very, very efficiently. Now, the other thing is the responsiveness and the attitude of all the medical staff that I dealt with, and I include even the porters at the IPO in Coimbra who help you get checked in, because that's another system you have to learn as well. When you arrive for appointments, outpatient appointments, especially in Coimbra, might not be the same everywhere, but in Coimbra, you have a little card which has got what is your hospital number on it, and you have to scan that to say that you are here. Once you scan it to say you are here, you're given a ticket with your number on, and then when your number gets called, you get to go to one of the cabinets, which are the rooms where the consultations will take place, and it will say D3, and off you go to D3, and that's it. But that's a system you have to learn as well, and the porters there are brilliant. And some of them even try to speak English, even if you do it all in Portuguese. They're really, really good like that. So everyone from the porters through to the consultant, and the consultation with the consultant was absolutely fantastic. We did the consultation in mixed Portuguese and English so that we could get the important information across. Very responsive, absolutely brilliant, and very clear about what would come next in the process as well. So all in all, it was, for something that I think before I did that transition, from an emotional point of view, it was very concerning, very, very worrying about how that would work out. But now, having been through that process, I can honestly say that being in their National Health Service is, dare I say it, and I'm sorry NHS, but it's a little bit of a breath of fresh air compared to my old UK NHS.
So my first experience of registering down the health centre was pretty good actually, because I took all my documents with me, and a top tip on that is keep a picture of your passport, a picture of your residency card or certificate, any other, if you've got a NIS, take a picture of that. Take a picture of all your most important documents, because they come in really handy at times when you get asked for something that you wasn't expecting. Really nice guy who spoke pretty good English down at the surgery, understood what I wanted to do. So for me, that registration process was quite easy, because at that time, they were not asking for the NIS numbers, so I was able to register. I needed to then see a nurse because I have regular injections. I kind of needed to do the next step, which was to get to see a doctor before seeing the nurse to have my regular injections. And that was more interesting. Because when I arrived at the surgery, the process is quite chaotic in there in the morning. There's a lot of people. There's about 4 or 5 different stations. with different receptionists, and you're not actually sure where you're supposed to go, whether it's because you've got an appointment or you want to make an appointment. That was all very confusing. So I had to sort of take a deep breath. Now, I had rehearsed in Portuguese what it was I was asking for. And the lady who eventually I got to a desk, she then sent me to another desk. And I went through the process again. And eventually, between us, she understood that I wanted to make an appointment to see a doctor. But because I didn't have at that time a family doctor, I couldn't have an appointment made for me. So I actually had to come down the health centre and go into what I call the bum fight, which is, and it is a bum fight, that you have to go down to the health centre at 8 o'clock in the morning, and everyone is in the same situation if you haven't got a family doctor. So you go down and you get into a bum fight situation. And, English people are very diligent about the way they queue. Portuguese people are maybe not quite as diligent as the way that they queue. So, bum fight's a good word. But anyway, it was good. I got an appointment for later that day. And that was fine, because once I had that, I could see the doctor, get the drugs that I needed. And interestingly, here, if you have injections, some regular injections and things like that, the surgery do not supply those injections. You have to actually go to a pharmacy, pick up your injection, your injectable, and then you take that with you when you go to see the nurse. So that was something new that I learned. But that process was fairly smooth. And then once you were in the system, that became fairly easy. And since then, I've needed to go to the doctors a couple of times more. And I've had to use that bum fight system. It's not pleasant, but it does kind of work. Like most things Portuguese, it does kind of work. So how I got a family doctor was really thanks to Gary, because when Gary went to the health centre and did the same process that I did, he actually did get asked for his NIS number, which he didn't have, and they told him to come back, but they did allow him to register. And Gary actually got allocated a family doctor. Now, that could have been by luck. It could have been that a new doctor had started, and so therefore they were allocating new patients, family doctors or whatever. But once you have a family doctor, you can make an appointment in advance to see that doctor. I then found out that actually, when I was talking to the receptionist at the health centre, I said, can I have a family doctor? My husband's got a family doctor. Could I have a family doctor? And she said, yeah, if your husband's got a family doctor, as his wife, you also can have the same family doctor. So I was like, brilliant, that is fantastic. And so I got a family doctor. And that does make life a lot easier, because you start to get into the system for checks, for things like COVID jabs and stuff like that. So getting a referral, I had a very bad episode of pain. To sort of tell you, I had a gallbladder issue, and I had that issue in the UK. And so when we moved to Portugal, I was hoping that it would go away, but it didn't go away. So I had a very bad episode of pain, had to go down surgery on the 8 o'clock run, see a locum doctor, potentially, I think it might have been locum. And she referred me straight away for some scans and some other bits and bobs, bloods, all the usual thing. And it was a really good process, that, because what happens in the UK is if you need bloods or you need a scan, you have to wait for the letter to come to your house from the local hospital, go down, have your bloods, or go to the surgery, have your bloods and have your scans. Here, they use private suppliers for things like that. So I was able to book my scan at a time that suited me in a local place, Using a private system, I was able to go down the town of Mortágua and I was able to get my blood tests done at a private clinic there. So that made that very quick. And then you send all that information back to the doctor. Then at that point, I made an appointment to go back to the doctor and she had a look at the scans and she said, yes, we need to refer you to a consultant. So she referred me to Coimbra Hospital, to a consultant who could help with this type of issue. And I think that appointment came through in about a month, really quite good. So went to Coimbra, had the appointment, lovely consultant there, really, really nice. And we concluded that I would need surgery. And so then it was a case of doing some pre-ops on the day and waiting for that surgery to come. Now, what he did say to me was, and this may not apply to every hospital, but what he said to me was, if you have not heard from us, if you've not had this operation within 6 months, we will give you a voucher to go private. He said, but we've never had to give anyone a voucher yet because we've always done our operations on time. And I thought that was amazing because in the UK, as my UK people that are watching this will know, you could be waiting years and not get any guarantee of anything that might happen to make that surgery quicker. So that really reassured me that I was going to get this sorted within 6 months. I had to have a couple of appointments by phone for pre-ops. The anaesthetists, it's one of those words, I hate that word. You know what I mean, the people that put you to sleep. They phoned me to take some information over the phone. And when the lady phoned, the first time they didn't phone at all, and on the day, even though I had my phone on, everything was in order, I didn't have any missed calls. So I then had a bit of trouble trying to get hold of that department to actually say, look, no one called me. And in the end, I sent an email to the hospital and that actually got through to them. So another appointment was scheduled. When that appointment was scheduled, they called on the day. The lady was speaking away to me in Portuguese. I understood about half of what she was saying. And I said to her, I'm learning Portuguese. This was in Portuguese. I said this, I'm learning Portuguese. I'm only speaking a little at the moment. Is it possible you could speak English if you speak English? And she then turned around to me and said, why did you move to Portugal if you don't speak English? If you don't speak Portuguese. So that kind of threw me out a little bit. That was like my first ever experience of someone being, challenging of the fact that I hadn't learned Portuguese. So I did put her straight and I did say, look, I am learning. So she was fine after that. Anyway, we got through that and everything was fine. And so then I had my surgery just over a week ago now, I think. And let's talk about that in terms of it was a tale of two halves. All I got was 2 weeks before the surgery, I got a phone call saying, you are having surgery on this date, at this time, at this hospital. And so I wrote that down, but I didn't get any more detail. And I said to the lady, will I get a letter through? And she said, no. So I'm assuming they kind of squeezed me into the schedule somewhere. On the day, Gary took me to the hospital, and I'm going to be honest and say it was probably one of the most stressful, chaotic things we've experienced since we've been here, because we went to where we thought, but we had no department, nowhere to report to, no name, no ward, nothing. So we kind of got passed from pillar to post, pillar to post. We were walking around the hospital. It's a big old hospital, Coimbra. And we kept walking around. And eventually we found someone who helped us, and they sent us up to the surgery ward. And the medical secretary said, you need some pre-ops. So back down again we had to go. Well, I can tell you that if Gary hadn't been with me, I would have probably burst into tears and walked out because I didn't want to have the operation. I was stressed. And that whole process was just enough to make you walk. And I did say to myself at that point, I'm getting private healthcare. But the actual surgery itself, I was so impressed by the professionalism, the kindness, the cleanliness. I felt like I was in a private hospital, just two to a room, lovely nurses, caring people, always there to make you smile, explaining everything to me all the way through. And I can honestly say I was moved to tears when I left, just at how kind everyone was. So that experience was nothing like I expected it to be. And that makes me a huge advocate of Portuguese healthcare.
Portugal's public healthcare system, which is, and I'm going to have to look at my notes here, the Serviço Nacional de Saúde, which is SNS. That's a tax-funded system, and that is for all legal residents. So that's the important thing to remember there. If you're a legal resident, then you are entitled to healthcare under the National Health Service. Now, it isn't always free. Sometimes there is what's called a co-payment, which you might have to make. And this goes through also to your any medication that you need. You won't necessarily get them free, but you get subsidized medication. With your prescription, you can go into your local pharmacy and you pay a net amount that you have to pay for your drugs. But with the co-payments, it might be that you go for a GP, you might book a GP appointment or a consultation, and there might be a co-payment which you're responsible for paying. And it's actually got a name. It's got a taxas moderadoras. I might have said that wrong. Don't at me, please. And that might be for things like if you go to the emergency room, A&E, then there might be a small payment that you'd have to make in that situation. So it's just something to be aware of. Everything is covered through to life-saving treatment, etc., especially in the emergency room, but there might be some co-payments which are needed as well.
So why do so many immigrants have private health insurance? Well, obviously it is a requirement of most visas, but private health insurance gives you kind of three things: availability, choice, and a wide network of specialists. And the biggest criticism of the healthcare system is the wait lists, and you could be on those wait lists for months. Although, bear in mind, my experience was no more than 6 months or you get a private voucher. That private healthcare will give you access to English-speaking doctors, a choice of hospitals, a much more hotel-like kind of hospital bed and room. Although my room, I thought that was first class. But that's what you're going to get with private healthcare.
So I would say what we've learned is that whilst a private healthcare might be excellent from a convenience point of view in terms of timing, etc., the SNS is a brilliant backup for everything that you are going to need. And I think that our story shows that, both my experience going through to the oncology team in terms of handing over my cancer monitoring as we move forward, and also Shelley's surgery experience. I think we are now living testament that the system is good, that it works, and it's very reliable. So Portugal's healthcare system, it might move slower than private healthcare here, but once you are in, the quality of that care is solid.
Yeah, even when things take time, the human side of that care has been brilliant. Nurses and doctors, I think they genuinely care.
An important takeaway also is that as soon as you are here and you have your residency status, then get registered straight away. Do not wait until you are ill.
No. And also, don't just rely on private insurance, because if you have a medical emergency, you might not be covered for that. But we find having a bit of backup on private healthcare as well as using the public system is a combo that's worked really well for us. So, you know, to conclude, we got sick in Portugal and we were genuinely surprised how good the public system is.
Yeah. So that is going to wrap things up this week. I think it's been a really useful conversation to have. I think we've probably, just in repeating it, we've learned a lot ourselves about the whole experience as we've revisited things. And I think it will be interesting, if you're already here in Portugal, have you had experience of the Portuguese healthcare system?
Yeah, because I'm pretty sure not everyone's going to agree.
I was going to say, I think there are going to be good examples
With
and
us.
there are probably less than good examples that we could probably quote. Please do drop us a comment below if you have any experience of that. That's really, really important to understand that. And obviously anyone that comes to watch the video, they get to see those comments as well. So they get to see to coin a phrase, the good, the bad and the ugly.
Yeah.
So yes, please do, as always, like and subscribe. We are trying to get this out to as many people as possible. And obviously we can only do that with your help.
Absolutely.
That is going to be it for this week. Unless you've got anything else to add to that, I think that's a wrap.
I need to go and sit down now.
Yeah, you need to go and sit down, straight out of surgery and straight onto the video. Yeah.
YouTube is demanding.
Yeah. So that is going to be it for this week. Thank you very much for watching. We will see you next time. And so